Hey, everybody, welcome to the live stream. We are excited today. We've got a special guest all the way from Taylor, Michigan, who's joining us here on the west side of the state. We are inside Mary Free Bed at the Mary Free Bed Inn, kind of tucked away a little bit from the same room, and I'm chatting with Shanta Favors. She is Ms. Wheelchair Michigan 2024. Can see the crown, the sash. Congratulations.
Thank you, Chris. Thank you for having me.
So we crowned you here in West Michigan and Grand Rapids in November of 2023, and we were at the hospital. But today you actually got to go in and tour the facility. You've been around the state doing all kinds of awesome, fun, and exciting things for your platform. But today you got to see a little bit of what rehab is like on the west side of the state. What was your experience like?
Wow. This facility is absolutely amazing. I've never seen anything like it from the end, from the outpatient for the youth and the adults. I went to Santa's Inn. Santa's Inn was absolutely incredible. This is where they're making the prosthetics, the AFOs, the brace. It was absolutely amazing to see. This has been a phenomenal experience, and it's something that I want to do again.
And Shante, you know something about healthcare because you worked in the field for quite a while. Tell me a little bit about your story. Where were you working before your injury? And just walk us through a little bit of your story.
Yeah, so I worked as a director of care, dedicated my career for 5 years, and then I got injured on the job. I was at work. I was in work for exactly 21 minutes when I tripped and fell walking upstairs and broke my neck. You know, and I'm here.
What was your recovery like? I mean, having to understand a little bit about healthcare, were you able at that point to kind of be your own advocate, or what was it like kind of being, 360 degrees difference then in walking through what you've seen with your patients?
It was first. It was mind blowing that this had happened to me. Doing something that we all did every day, take for granted. Just walking upstairs, I was very careful, and I tripped and fell. So my recovery was it was a long process, one that was it played on my mental health. First of all, I felt like how did I go from a director of care to needing total care? Um, but then I had to have that moment where I said, "Hey, Shantae, you want to get better? You need to be your advocate. You need to speak up for yourself." And that's what I did. I took full charge of my recovery, and I'm still recovering every day. To this very day, I still attend outpatient physical therapy and outpatient physical therapy and occupational therapy.
And so this was 6 or 8 years ago, you said, right?
6 years
6
ago.
ago. How are you feeling like now? Or did you feel like you're kind of in tune and accept where you are with your body? Did you feel like there's still growth or things you can do with your own kind of recovery process and rehabilitation?
But first, Chris, I learned to stop saying I'm going to accept this disability because that was hard for me to do, to accept that this had happened to me, accept this as my norm. But instead, I own this life. I've owned every part of me. Do I wish this disability never happened? I'll be dishonest if I said I didn't hate that it happened to me, but I would be dishonest if I didn't say that I love my life just how it is because I've learned to take full charge of my life. I'm still recovering every day. I don't want to look back 10 years from now and have a single regret of what I could have done or what I should have done, or maybe I'll be here. Well, I'm giving it my very all. So in 10 years from now, 20 years from now, if I'm still in this very same position and I've made no more recovery, I did my very best to give it my all, so yeah.
So now moving from your own journey to now this journey of Ms. Wheelchair Michigan. You are Shante Favors, but you are all now Ms. Wheelchair Michigan. What was that like when you first heard of this competition and then thought, you know what, I think I might participate in that?
When I first heard this competition, I think it was 2 years post of my injury, and I was encouraged by a number of people to compete for Miss Wheelchair Michigan, and I was apprehensive, because I didn't feel that I was ready. I didn't feel I can commit. And one thing about me, when I take on something, I want to give it 110% of my time, or do it not at all. And so I wasn't in a position mentally where I could do that. But then I was sent the message on Messenger by a former Miss Wheelchair Michigan saying, I watch you. I like what you're doing. I think that you'll be phenomenal as Miss Wheelchair Michigan. Have you heard of this organization, and I did. And then she said, "I think you should compete," and I told her I would. So she said, "Well, the deadline to compete is tomorrow. So you have to get your application in by tomorrow." So I did that, got my application in, and I looked. Oh, I need a platform, and the other part of with the competition was in 5 days. So yeah, I had 5 days to get ready, but my passion, I picked a platform that I'm 100% passionate about, which is bridging the gap between caretakers and the disability community. Having that 360 viewpoint, it wasn't something that I had to really think long and hard about. It's here, it's right in my heart. So I roll it with a purpose, turning universities into advocacies.
Yeah, tell me more about that. Like, what does that mean, and where did you come up with that name? Like, what is this bridging the gap between caregivers and patients?
It's okay. So to bridge something means to make a connection, and I feel that there's a big bridge that lies in the middle of caring and receiving that care. So care recipients and caretakers go hand in hand. The two cannot exist without the other. So I felt that in order for us to have that quality care, we need to truly bridge the gap that exists when it comes to caretakers, specifically our direct caretakers. They are often, and this is speaking from both experience of the live and professionally, that they are often overworked and underpaid. They lack comprehensive training. They they're given this caseload and say, "Hey, you may have 15 people, and out of these 15 people, there may be a Hoyer lift, there may be some sort of a catheter, right?" So they're given this task and say, "Hey, I need you to go in and make sure this person is cared for," but with no directions, right? No directions. Payment. So the reality is the cost of living is steadily going up, but pay is not steadily going up. So it's causing a number of people to leave a field from experience. To get in this field, you have to have a heart for it. It has to be something that drove you to become in a field, whether you CNA, a PCA, residential care aide, a director, nurse, doctor, anything. When you provide and care for another human, your heart has to be in it. You have to lead with empathy and compassion. And so and I saw a number of people that I know for a fact was in the field for those reasons, but leaving the field for the very reasons I'm advocating for. It did something to me. Like I have to do something. Like we have to be the change you want. We can be the champions of change. So we just have to roll with purpose. Now I'm rolling with a purpose. This adversity, it happened, but I can do something about it because I do have that 360 point. I could be a voice for those whose voices are often marginalized. So that's where it came from.
And you have seen photos, I've been following you on Facebook. You've just really been really active since you won in November. Like that's the whole point of this program is to educate and inspire and help the participants become these advocates where so you have this crown for the year, but then you're going to live this life for the rest of your life. And hopefully they're building advocates. And what has this past year been like for you? What kind of experiences stand out to you? And what kind of changes or impacts do you feel you're already making?
This has been for me everything. So you kind of when you go have a career like I had, and it was literally my career. I slept it, I dreamed it, I walked it, I did everything. It was my life. And then in the split moment of second, just walking up the stairs, it took everything from me. It took that from me, right? And to have that moment where you know what, I could still do something about this. Like I may not physically be able to go do these hands-on things, but I could use my voice to make a impactful change. And so this has been everything to me. Going, speaking to lawmakers, speaking to healthcare professionals, speaking to caretakers, speaking to the disability community, holding these forums, which to me the best part of this, the whole form is because sometimes we have to teach people how to treat us. And on the other hand, the disability community need to learn how to treat people to be treated, right? So you're dealing with something, whether it be physical or mental, sometimes it doesn't come out as the greatest. You come out very mean, come out rude. And that's we learn how to work together, we can really change the conversations and the trajectory because there is so much power in numbers. So I often tell people, I implore you to see me as a representation of a larger community, not just someone that's disabled, but as a larger community, someone that was in the field, right? Someone that could give you this perspective on both ends of the equation of care. And so it's been absolutely amazing to hear the feedback. People are being intentional and they're listening because I'm being intentional in my advocacy. So I'm one of those individuals that I demand my respect. I demand it. So I roll in the room with full confidence and authority. I command any room I roll in, whether it's a large crowd, a small crowd. I'm not intimidated. I am not intimidated.
Yeah. And how do you feel like looking forward to this national competition? You probably heard about it, you've seen it, you maybe watched some footage or something from it, but how do you feel like looking forward to what are you looking forward to most in this national
I'm
competition?
actually looking forward to meeting the other women. So we have connected. Connected with so many of them. Like we exchange text messages. We have this Zoom once a week where we're getting to know each other. So I'm really looking forward to that camaraderie, being with these other women who are fierce, passionate advocates like myself. I'm looking forward to hearing these platforms, how we can work together. It's yes, it's a competition, but each of us stand for the same thing. We are advocating for the rights of people living with disability. Because far too often people look at disability as a bad word, as a bad name, and they see us for something that we're totally not. So to have 25 other women in the same space and place with the same agenda, our platforms may be different, but our mission is still the same. So I'm looking forward to that.
That's so exciting. What has been like the most fulfilling part of this so far, this experience of being Ms. Wheelchair Michigan?
The most fulfilling part is literally being heard by the decision makers. To have someone take that time out to hear you, not just it going on deaf ears, but responding, having that follow up. I've had face to face conversation with lawmakers. I wrote my email, talked on the phone, but to have that follow up to say, "Tell me more. I am interested in what you're talking about. Tell me more. What is the drive? What is the motive?" And the motive be nothing more but to help our disability community and the well-being of our caretakers, putting people first. This is a reality for many, for all of us, right? Regardless of you are physically disabled or have a loved one, the reality is we will all be disability some way, somehow. And so today we put in those plans of actions today, we can have that preventable care. We can take those preventable measures to change the trajectory. And that is my aim and my focus is to 360 bridging the gap. That is my hashtag. Those little 360, those numbers hold so much power. It's a full circle and that bridging the gap. We truly need to bridge the gap. What can help us save lives and help us eradicate the caretaker shortage crisis. It is an act that we ourselves can't do alone. It requires our federal government to step in. And so, being vocal as I am, and I'm a people person, I could connect with people on every level, no matter what room you put me in. You put me in a room with a pack of dogs, I'm gonna connect with those pack of dogs. Yeah. And so, I'm just eager. I am eager to see this thing through. Of course, the aim is to become the next Miss Butcher America 2025.
That is awesome. And that's exciting. I know we're rooting for you here at Mary Free Bed, and also I know across the state are. So being a people person, let's name drop a little bit. Who are some of the people that you met so far this year, and who is on your list that you still want to meet?
Okay, so I've met. So I'm gonna start with the Disability Network Commission. I'm literally 5 days after taking the crown, I got online. I'm started looking up who can I connect with to help me to do my mission. I don't want just to have a crown and a sash, but I really want to embrace this crown and sash. I don't want to do it just for I want to do it for to produce change. So I connected first with Rachel Hudson from Disability Rights of Michigan. Disability, she and I had a number of conversations, and then she said we're having a training where we're gonna have a number of attorneys, disability rights attorneys, come together and people from the community to see, and I think it would be very effective. So from that one meeting, I met over 35 disability rights attorney. I connected with a public policy analyst, Brett Williams, from the Department of Health and Human Services. Absolutely phenomenal. I met with Rashida Tlaib, the United States Congresswoman. I met Lieutenant Governor. I've met I met with Sharon McDonald. I met with State Rep. Aaron Burns. I met with Senator Jeremy Moss. I met with State Rep. Samantha Sackler. I can go on and on. I connected with doctors and nurses and other people living this life. I attended the NAACP Fight for Freedom dinner where the keynote speaker was our 46th president, Joe Biden. Um, my goal, though, is to have a face-to-face conversation with the president, whether it be the current president, future president. It's my goal to have a conversation with the president because I believe the conversations, that is the way you change the trajectory. You have these conversations to get to a place where we can level the playing field when it comes to personal care assistance. And who best to assist than someone that's literally on both ends of this equation of care. So when you hear me speak, I want you to know I've been on both ends of this equation of care.
That's excellent. I mean, just love listening to you speak and to share your experience and then also your hopes and dreams on where you're going to be taking this. So, as we start to wrap up this interview, we've talked about your excitement for Ms. Wheelchair America coming up. What would be advice you would give to somebody who is maybe a newly injured, new illness, and now they're using a wheelchair? What would your advice be to them?
Give yourself grace. Give yourself grace. This battle are not won by doing nothing at all, but a battle is won by getting on that front line, and the front line is your life, right? So I would tell you to give yourself grace and know that this takes time, right? It takes time, but you have the ability to keep going because a disability is just a different ability. So I would ask you to readjust, speak to people, reach out to me if you need to. I am someone that you can talk to. I am also a peer support mentor for United Spinal Association. So I am a peer mentor, and I'm here to help you get through this. I will ask you to don't be silent, because having catastrophic injury or any injury, it can play on your mental health, and it can't very well take your life if you don't speak up and get help. So give yourself grace, give yourself time, get help. Mental health matters, especially in this situation. I would tell you there's nothing wrong with doing those steps.
And last question. You toured Mary Free Bed and you got to see some staff and some patients, but if maybe there's a staff person who's watching this that didn't get to meet you or a patient who didn't get to, what would you say to them, to the hardworking healthcare people here or the patients that are recovering and hoping to go home? What's your word of advice to them?
I would say thank you. I would say be an advocate. Be an advocate. Be your patient's advocate. Get to know the individual that you're caring for beyond that bed because they are more than a diagnosis. I would say thank you. I would say go to your charge nurse if you're a nurse. If you are a PCA, go to the nurse when you had enough. All right, you're tired. Speak up for yourself. I would say thank you and actually continue to do those amazing things. Always remember, we are real people, real stories, real dreams, real lives. We just want a little help and we need help. And I wanted to thank Darcy. She gave an amazing tour. She was very eager. Her passion for this place speaks for itself. So thank you, Darcy, for the tour that you gave my husband and I. We appreciate it.
Awesome. Well, Shanta Favors, thank you so much for coming out to Grand Rapids and touring Mary Free Bed. I know everybody that saw you here really enjoyed that. And if you're watching this, make sure you keep your eyes for August 19th to 25th. That's when the National Miss Wheelchair America comes to Grand Rapids. They've got amazing stories just like Shanta Favors. And we're rooting for you, Ms. Michigan, but we're just excited for all the women to come here. So stay tuned. And we'll make sure to share you those when we get there. So thanks for watching and stay well.